Some of the doctors will have their own arguments for this diagnostic histolaparoscopy. We have to make one thing understand. We have to have a common alignment. It is, in my opinion, and for the welfare of the clients, and considering the pros and cons, I am telling this avoid. So now, no IVF ICSI end to end, or say no IVF ICSI. We are on the 10th part. The 10th part is something laparoscopy and hysteroscopy before IVF and before ET. So this is topic which we should have an understanding and the need for it. Generally, some facilities, they are doing a diagnostic laparoscopy or hysteroscopy or a tubal patency. So this is little an expensive modality. Beyond the expenses, I feel it is an invasive procedure. Like, we are subjecting the female partner for surgery, for anesthesia, for medications, all these things. A tubal patency can be easily checked by an X-ray through HSG, hysterosalpingogram, or through an ultrasound through SSG, sonosalpingogram. So generally, for a diagnostic modality, using an histolaparoscopy is not the right sense. So we can try to avoid it. So it's all, it is my acceptance that it's not mandatory or needed. But always I feel in this medical field, there are a lot of conflicts happen. Some of the doctors will have their own arguments for this diagnostic histolaparoscopy. We have to make one thing understand. We have to have a common alignment. It is, in my opinion, and for the welfare of the clients, and considering the pros and cons, I am telling this avoid. It is like up to the clients, couples, as well as the treating physician and the gynecologist to take a call whether to avoid this histolaparoscopy or to go for some exceptional reasons or for their own judgments. That is the difference. So secondly, this is because beyond this indication also, doing this procedure which is involving this anesthesia and medications and other things. Secondly is the cost factor. In histolaparoscopy, for a minimum thing, it can happen anywhere between 50,000 to 1 lakh. Sometimes unknowingly, on doing this diagnostic procedure, we are ending up in doing some therapeutic small intervention. It can be a polyp or a small fibroid or a myoma. It can fetch you another addition of 50,000 to 1 lakh. So now imagine, so this is almost a cost of IVF ICSI package. So when you are going through all these procedures, you should be financially prepared sufficiently, or you should express your inability to the doctors well ahead of time so that you are in the common alignment. There should not be any discrepancy or difference of opinion. There should not be any disturbance during the course of treatments. So you, when you're undergoing the treatment, please ask your clinicians and make them give it in proper transparent documentation that our routine is we have to do an embryo hysteroscopy, laparoscopy after the egg pickup and before the embryo transfer. Means what is it needed? Is it be justified? And if they are going to give the justification, and if you are convinced, please go ahead. I'm not against it. But in my opinion, as far as international scientific publications, a diagnostic histolaparoscopy is not really mandatory. Secondly, we need to understand some of the clients, due to that repeated failures or a fluid in the fallopian tubes, they are sometimes requested to go through this tubal ligation. So this tubal ligation, I've made it as a separate topic and I will make it as a separate discussion because it needs even further understanding. I don't want to mingle in this topic, that is why I made it as a separate topic. There I will make it elaborate. Right now, histolaparoscopy can be reserved, can be avoided and can be performed only in really indicated cases. So let's see in part 11. Thank you.